Hello, this is Dr. Bruce Garber. I'm an erectile dysfunction specialist in the Philadelphia area, and in this short presentation, I wanted to review with you Diagnostic Strategy for male erectile dysfunction. Now, when someone comes in with erectile dysfunction, we approach it in a systematic fashion. We have to do an interview, we have to do an exam, we have to do certain blood and urine tests. We usually use validated questionnaires, and many times we offer some specialized testing in order to pinpoint the cause of the problem. For example, we have a number of questionnaires which are quite helpful. Some of the main or more frequent ones we use include the International Index of Erectile Function and the Sexual Health Inventory for Men. The IIEF questionnaire is quite comprehensive. It has 15 questions on it, and it goes over most aspects of male sexual function. Many times we use a shorter version called the Sexual Health Inventory for Men, or SHIM for short. This has just 5 questions going over male erectile function. You can fill out the questionnaire and total up your score. And these questionnaires not only help us diagnose erectile dysfunction, but we're able to grade the severity of it. The higher your score, the better you're functioning. The lower your score, the more severe the ED is. So these questionnaires allow us to diagnose erectile dysfunction and also to monitor your response to treatment. Of course, we have to do a physical examination. We look for signs of poor blood flow. We check for Peyronie's disease or scar tissue on the erection chambers. And we look for other things that might interfere with the ability to get an erection, including signs of prostate cancer, diabetes, or neurologic problems. We usually do some type of laboratory evaluation. For example, we almost always measure the male hormone level. However, it's a misconception. Many men think that if they're not getting a good erection, they must have low male hormone level. In point of fact, this is rarely the case. Most men with erectile dysfunction have trouble with their penile blood flow and not their testosterone level. We also check a blood sugar. You'd be surprised how many men come in for erectile dysfunction. We find out that they're diabetic and they never knew about it. There are some other tests we do. We try to individualize it for each person. Now, many times we offer some specialized testing for erectile dysfunction in order to pinpoint exactly what the problem is. Probably the most frequent one we use is what we call the Penile Duplex Doppler ultrasound study. The Penile Duplex Doppler study can be done right in the office setting. We use ultrasound to scan the penis, and we're able to see the small arteries running through the penis. Not only are we able to see the arteries, we're able to measure the size of the arteries, and we're able to non-invasively measure the amount of blood flowing through those arteries with each heartbeat. This penile Doppler study shows a normal amount of blood flowing through the penile arteries with each heartbeat. However, if you look at this study, you can see that there's very little blood going through his penile arteries with each heartbeat. And this is the typical tracing of someone who has partially blocked penile arteries. That's why he's not getting a good erection. And we frequently see this in men who have diabetes or high cholesterol or who have been cigarette smokers. This slide shows a test that we do not use very frequently anymore. It's called the Nocturnal penile Tumescence test. It would involve wearing a monitor on your penis during the nighttime, and the monitor would record any nocturnal or nighttime erections that you might develop. This slide shows a normal nocturnal penile tumescence test. This man was able to get normal erections while he's asleep at night, and in this situation, it usually indicates that there is no organic problem. By contrast, this tracing shows a man who is not able to get any rigid erections at nighttime, and this is usually indicative of a physical type of erectile dysfunction. However, these tests are not used frequently anymore because we're normally able to get the required information by other methods. So what do we typically find when we're done with our evaluation? Well, in the typical man, we find that he has some type of organic problem, usually a problem with the arteries, the veins, the nerves, or some combination thereof. However, we also find that most men have a psychological overlay. And what I mean by that is as follows. When a man notices that his erections are not very good, he gets embarrassed, he gets discouraged, he gets frustrated, he gets preoccupied with his performance. And when he's in a sexual situation, he gets what we call performance anxiety. And that performance anxiety makes a bad situation worse. So most men do have a physical problem. Almost all of them have the psychological overlay. In any event, thank you for your attention. This has been a brief review of our diagnostic strategy for erectile dysfunction. On the next video, I'm going to go over medical treatments for erectile dysfunction. And for those of you who want more information, feel free to visit my website, garber-online.com, because there is a lot of information on there, including photos and video and YouTube and publications, for those of you who want to go into this topic in more detail.